So hello, everyone. I'm Yvonne Zurynski. I'm Professor of Health System Sustainability at the Australian Institute of Health Innovation at Macquarie University. And I've been involved with the NHMRC Partnership Centre in Health System Sustainability for the last 5 years or so. And we have been delighted to work with Leanne Wells, who was the CEO of the Consumers Health Forum until late last year. And we've been delighted to work with the CHF over the last 5 years or so on various projects. So welcome, Leanne, and thank you so much for agreeing to speak with us.
Thanks, Yvonne. Pleasure.
So as a consumer advocate and former CEO of the CHF, what benefits do you believe were gained for the CHF through your involvement in the Partnership Centre?
Look, I think enormous benefits for an organisation like the Consumers Health Forum of Australia. I think four main things I would say were beneficial. I mean, first and foremost, just the opportunity to walk the talk. There is a joint statement about consumer involvement in research between CHF and the NHMRC. So that's the first thing. But I think there was so much skills transfer both ways from the consumer insights that CHF could bring into various aspects of the centre's work. And likewise, back the other way, and we'll talk a bit more about that in a moment, I'm sure. The other benefit was, the opportunity to partner and bring to the fore some new research, to partner on strategic events that had a research dimension or an academic dimension that did impact and influence policy. Probably the final thing for an organisation like CHF, doesn't have a huge budget, doesn't have a huge media team, that's hashtag NGO life, isn't it? The partnership was fantastic because it helped with, played a role in CHF's visibility and relevance, I think, particularly, some of the data and some of the narratives we were able to mount in our media commentary and in our advocacy as a result of the sentiment survey.
Yes, and certainly I think the team learned a lot from the CHF and from our involvement together and working together on projects. And we really enjoyed working with you and with James Ansell and with Joe Root, and particularly when we co-designed the Australian Health Consumer Sentiment Survey. And you were really the driving force behind that survey. We just came along and helped out as best as we could, but you were the driver behind that. Tell us why you were so passionate about that.
I was passionate about the consumer sentiment survey because, I saw so many occasions where, consumer insights were at the table, and consumers were bringing a lived experience perspective, but that lived experience perspective can be so much more amplified when you've got data across a broad spectrum of findings and insights from a longitudinal survey like the Australian Consumer Sentiment Survey. So I just felt it was like gold, really, and to have the opportunity to co-design and advocate with impact, backed by the additional insight that came through that sentiment survey, was fantastic. Because as you know, media, policymakers, they like data, they like new insights, they like things that can help put a fresh angle on things.
Yes, and I think it was really fantastic to be able to collect, data from a representative Australian sample of the population, and we have over 6,000 responses to that survey, which is really fantastic. And hopefully there will be another round of the survey coming out shortly.
Absolutely.
So, Leanne, I want to take you back to, must have been 2021. And I remember doing a masterclass on implementation science for the CHF membership during one of your annual general meetings on Zoom during COVID. with over 100 of your members attending. We'd never done anything like that. It was really a bit of an innovation, and certainly, we were very keen to engage with consumers around implementation science. From the health consumer perspective, how was that received by the CHF board and your membership?
Look, I think it was well received, Yvonne. And I think the point to make there is, each sector has its own lexicon, doesn't it? And you hear terms, consumers sitting in research meetings or at the policy table, are often confronted by terms like improvement science or implementation science. And, it's a brave person who says, as a consumer advocate, I don't know what you mean. I don't know what you're talking about. So having the opportunity to have you, to host you, to offer that masterclass, I think was fantastic. And the other point to make is consumers, don't often get the same skills and knowledge development opportunities that clinicians do and that researchers do. A lot of their work is volunteer based. So unless they're part of an organisation on a board or on an advisory committee where there's some investment in consumer skills and knowledge development, they don't get that. So it was a fantastic opportunity to bring that masterclass to the members and to help demystify implementation science.
And we certainly enjoyed it and had some very good questions from your membership about it.
Yeah.
We also did quite a few PCHSS webinars, particularly during COVID. We went online quite a bit and promulgated our projects. But the one that really stands out in my mind was the one on social prescribing. And you led the Australian Roundtable on Social Prescribing. And we did a lot of work together to influence policy in that area. So I wonder if you could tell us a little bit about that, maybe describe what your definition of social prescribing, and where are we at with social prescribing in Australia at the moment, and what does the future hold?
Look, I think there's no doubt there's growing momentum around social prescribing as a practice. It's a really vital health tool. I think it's something like 70%, social determinants of health drive 70%, I think, is the figure of healthcare outcomes. So what does that tell you about what models of care should look like? So social prescribing is, put simply, a prescription or a referral to community-based supports, community-based services, obviously non-pharmacological script that just connects people up and motivates them and supports them to get engaged, to overcome isolation, to exercise, to access, it might be employment pathway, support options, all of those things that can help overcome the challenges they face in chronic disease self-management, that can address lifestyle risk factors and those sorts of things. So look, so that's my simple definition, and it's certainly growing. It was an absolute pleasure to work with, and I think we had the triumvirate here, didn't we? We had the research collaboration, we had, the RSCGP, we had the professional voice, we had the involvement of Allied Health Professional Association, their peak body, and we had consumer voice in the room, peppered right across that roundtable room, to really come up with a broad implementation plan for social prescribing. And I think it has influenced policy. It's written into the 10-year plan for primary care, and a feasibility study is written into the 10-year plan for the National Preventive Health Strategy. Where does that leave us? It sort of gives it a policy imprimatur, I guess. But I think the more powerful thing that's happening, and this is about where change happens in the system, doesn't happen top down all the time, and often is more powerful when it's driven and championed locally. So we've already got some local councils, some primary health networks actively investing in social prescribing. The big gap now really is evaluating those models and the outcomes they're getting, so that we can scale them. And I think that's something your centre is very interested in pursuing and would be valued by consumers.
Yes, certainly we've developed a number of collaborations, and we're certainly working towards a grant to evaluate one of the social prescribing programs in the Illawarra Shoalhaven. So really looking forward to that. So Leanne, I asked you about the CHF and the benefits for the organisation, but what about you personally? How was it working with the PCHSS group? What did you gain? What was really challenging? What skills or knowledge or insights did you acquire?
Well, I guess, I'm not an academic. I'm not, that world is not entirely foreign to me, but I suppose I gained a lot professionally and personally. I gained the confidence to be part of and speak up in research teams. I certainly gained and really valued gaining the skills to be a contributing author to peer-reviewed publications. And I think that's fantastic. The more consumers we see involved in research, contributing to literature is a great thing. And that was certainly something, again, that I got from the partnership. I suppose the insight is just how, and you live and breathe this every day, just how competitive it is. To get the research dollar, to get those grants, to put those research teams together. Yeah, I don't know whether there are any huge challenges so much as, skills and exposure and insights to be gained.
Insights into the ethics processes, etc.
Indeed.
How long it takes.
How long it takes, yeah.
So looking to the future, you're no longer the CEO of CHF, but I know that CHF will always be near and dear to our hearts. What are your hopes for consumer collaboration and involvement in the health system and in health research for the future?
Yeah, thanks, Yvonne. And look, CHF's in fantastic hands. As far as consumer collaboration and involvement in research goes, I hope it continues to mature. I really hope to see more consumers as CIs and AIs in research teams, but importantly, see them equipped and mentored to play those roles and fulfill those roles. I think that's really important. I'd like to think that, health system research, to my mind, is where the action is. If you think about value-based healthcare and health system sustainability, then right now, health system research is where it's at. So co-design of services and systems and involvement in evaluation, that's really transformational. I hope that consumer voice and consumer participation is really embedded as no longer a token gesture, but very much a business as usual. This is common practice and best practice in how we do health system research. And I guess the other thing we worked on too, Yvonne, was some early conceptualization around an Australian Consumer Leadership Academy. That's broader than consumer research skills, obviously, and building capacity there. But I think some infrastructure like that is something that I would continue to hope for as well, because it's another piece of architecture then that helps really elevate, the systemic role that consumer advocates can play.
And I can only wholeheartedly agree with you on that. Leanne, I want to say thank you very, very much for your time and for your collaboration and for your friendship over the last 5 years. And I'm sure that will continue. We continue to work with consumer organisations of different types in our research, and I'm really looking forward to the future and possibly to working with you again. Thank you.
Yeah, thank you, Yvonne.
Is that okay?
14 minutes, 31 seconds.
How many?
14 minutes, 31 seconds.
Oh,
Perfect.
you're worried it was going to go over time.
Are we pro or what?
Absolutely.
My nose was dripping, so
Oh no.
so I had to. Oh well, I'm human.
Yes, well, I don't do much public speaking these days. So, I don't have, remember Mark Metherell, our communications director, I always used to have him in my ear saying, stop